The following show is for educational purposes only. It is not intended to diagnose nor treat any medical condition. Any information or recommendations provided should always be discussed with your healthcare professional. Welcome to another episode of The Patient Talks. I'm Physician Assistant Frank Smith. On this week's episode, we're going to discuss atrial fibrillation. On last week's episode, I discussed the basics of blood pressure, and I realized after I got done with the show that there were a couple of concepts and ideas that I discussed there that would dovetail very nicely into a discussion about atrial fibrillation, and that's what made me decide to do this show this week. We're going to discuss the underlying physiology of what's happening in atrial fibrillation, what the consequences of that can be, and why it's very important to stay on top of the treatments that are prescribed by your clinician. To start, we're going to discuss how the heart is supposed to function, and then we're going to get into what has gone wrong with atrial fibrillation. There are 4 chambers to the heart. The bottom 2 are the ventricles. These are thick-walled muscular chambers, and they have to be, because these are the ones that send blood throughout the circulatory system of the body. So we need a lot of force to send blood where it's supposed to go. Meanwhile, up at the top of the heart, there are 2 other chambers called the atria. These are very thin-walled chambers because all they're having to do is to help assist shoot blood down into the ventricles so that they are completely full before they contract to send it throughout the body. We call that contraction of the atria the atrial kick, and it contributes somewhere around 20 to 30% of the volume that the ventricles send out into the body. Now, the way that occurs is through the wiring of our heart. Up in the atria, there is a bundle of nerves known as the sinoatrial node. It is one of the heart's natural pacemakers. It has tendrils of nerve fibers that go throughout the atria. When it receives a signal, it sends a pulse through those nerve fibers into the atria and they contract. Meanwhile, there's another trunk of nerves that go from that pacemaker down to the one in the ventricles, the one that we call the atrioventricular node. And that one also has tendrils that go throughout the ventricles. So what's supposed to happen is the SA node, the sinoatrial node up at the top, receives a signal to fire. It sends an impulse throughout the tendrils that go across the atria. They contract. Meanwhile, very quickly afterwards, that signal has gone down that trunk of fibers to the atrioventricular node. It fires and it sends the signal throughout the ventricles and have them contract. That is what's supposed to happen when our heart is working the way it's supposed to. In atrial fibrillation, the 2 chambers at the top of the heart have basically lost their rhythm. Instead of them contracting like they're supposed to, the cells that make up the lining of those chambers starts to just quiver instead. So we don't have a nice fluid contraction to send blood down into the ventricles. That can cause a couple of problems. One of them is we no longer have nice, clean flow of blood coming out of the atria into the ventricles. It can be a very disorganized flow, and you can develop eddies within the blood that's sitting in the atria. If you have ever sat along the side of a creek or a river and watched the water go by, you'll notice along the bank you'll have some areas where a whirlpool will start to flow, or the water becomes a little stagnant in that area despite all of the other water going by. That is what can happen within the chambers of the atria during atrial fibrillation. And the big problem with that is the way our blood is designed is if there's very little movement to the blood, it starts to clump. It's what allows us to clot whenever we have a cut. But you can have that process start to occur in the atria. And eventually that little clot that is formed in the atria can fall into the ventricle, and the next time the ventricles contract, it can send that clot through the bloodstream, and that causes a significant risk of stroke. The other problem that can happen with atrial fibrillation is because those two chambers are sitting there quivering, it can send some erratic signals to that sinoatrial node, that SA node at the top, and it can transmit that down to the AV node at the ventricles. And the next thing you know, the ventricles are starting to have a very erratic rhythm as well. And that's why a lot of times patients with atrial fibrillation will have a very uneven heartbeat, is because the pacemaker down in the ventricle is getting an erratic signal, and that ends up producing an erratic pulse. One of the risks that can occur is that the signal coming down can start to try to match what's going on with the atria, and then the ventricles are trying to do that as well. And what you can end up with is what we call atrial fibrillation with a rapid ventricular response. And what that means in English is your pulse rate can suddenly skyrocket because it's trying to keep up with all the erratic activity that is happening up in the atria. Those two problems are why most patients with atrial fibrillation tend to be on a couple of different medications. One of them are anticoagulants, what patients a lot of times will call blood thinners. For the record, those do not thin your blood. What it does is it affects that clotting process. And based on the medication, it can be attacking that a couple of different ways. But what it's trying to do is to try to stop the production of clots that may form up in those atria because of the disturbed movement of the blood. The other medication you may be on is for rate control. We're trying to keep the number of signals from the atria that's dropping down to the ventricles, we're trying to keep those more regulated so you don't suddenly have an increase in your heart rate. And that's why it's very important to stay on these medications and be diligent about taking them. While I'm thinking about it, some of these medications can interact with other meds and certain foods. Be sure to talk to your clinician about, are there any foods that you need to avoid, or is there any of your medications or supplements that you may be taking that may have an impact on the efficacy of the medications you're on for your atrial fibrillation. So that's the basics of atrial fibrillation, A-Fib for short. I hope this has been educational. I hope you've enjoyed the show. If either one of those is true, please click the like and subscribe button down below. I'll be back next week. Until then, you better make me look good. See you soon.